blood pressure is where hibiscus may really shine, a disease affecting 1 billion people, killing millions. Up until 2010, there wasn't sufficient high-quality research out there to support the use of hibiscus tea to treat it, but there are now randomized, double-blind, placebo-controlled studies where hibiscus tea is compared to artificially colored and flavored water that looks and tastes like hibiscus tea, and the tea did significantly better. We're still not sure why it works, but hibiscus does appear to boost nitric oxide production, which could help our arteries relax and dilate better. Regardless, an updated review acknowledged that the daily consumption of hibiscus tea may indeed significantly lower blood pressures in people with hypertension. But by how much? How does this drop in blood pressure compare to other interventions? Well, the premier clinical trial when it comes to comprehensive lifestyle modification for blood pressure control is the premier clinical trial. Realizing that 9 out of 10 Americans are going to develop hypertension, they randomized 800 men and women with high blood pressure into one of 3 groups. One was the control group, the so-called advice-only group, where patients were just told to lose weight, cut down on salt, increase exercise, and eat healthier. Here's a brochure. In the 2 behavioral intervention groups, they got serious. 18 face-to-face sessions, group meetings, food diaries, monitored physical activity, calorie and sodium intake. Now, one intervention group just concentrated on exercise, and the other one included exercise and diet. They pushed the DASH diet, high in fruits and vegetables, and low in full-fat dairy products and meat, and in 6 months achieved a 4.3-point drop in systolic blood pressure compared to control, slightly better than the lifestyle intervention without the diet. Now, a few points might not sound like a lot. That's like someone going from a blood pressure of 150 over 90 to a blood pressure of 146 over 90. But on a population scale, a 5-point drop in the total number could result in 14% fewer stroke deaths, 9% fewer fatal heart attacks, and 7% fewer deaths every year overall. But a cup of hibiscus tea with each meal didn't just lower blood pressure by 3, 4, 5 points, but by 7 points, 129 down to 122. And in fact, tested head-to-head against a leading blood pressure drug called captopril, 2 cups of strong hibiscus tea every morning, using a total of 5 tea bags for those 2 cups, was as effective in lowering blood pressure as a starting dose of 25 milligrams of captopril taken twice a day. So, as good as drugs, without the drug side effects,